morning.
Morning.
Thank you for coming out today. My name is Ann Lindgren, and I am the president of AFGE Local 789. I am also a veteran of the United States Air Force. So the issue we will be talking about today is near and dear to my heart: keeping the promise to veterans and staffing the VA. We have speakers here today who want to share the amazing experiences they have had with the VA, but first I wanted to make a few points. Since 2013, our work has increased by more than 10%, totaling around 20 million additional provider hours of care. Yet currently, there are approximately 49,000 vacancies throughout the VA. 36,000 positions relate to frontline care of veterans. In a recent poll conducted by the Veterans of Foreign Wars, 92% of veterans say they want the VA to invest in fixing the deficiencies, not a universal health care card or privatization. Veterans have spoken. Is Congress listening? The VA's medical and clinic facilities are not just healthcare centers. They are healing and treatment communities. The type of specialized care and access to others who are going through similar treatments and who have endured similar injuries creates a community that cannot be replicated. Many civilian providers do not understand the community that the VA creates or the issues that veterans face in treatment. For instance, 87% of civilian mental health care professionals do not possess the proper skills to treat veterans. We are having this rally today to stop any further efforts to dismantle the VA and demand that vacancies at Jesse Brown VA be filled immediately to ensure our veterans receive the care that they have earned. We demand that the Congress and the administration act immediately to keep the promise made to veterans. For those of you in the audience, please take a moment today, call your legislators and ask them to support the House bill and Senate bills, VA Staffing and Vacancies Transparency Act, and Strengthening Veterans Health Care Act. Again, thank you for being here today. As I mentioned, we had several speakers who would like to share a few words regarding this issue. First, I would like to introduce National Vice President with AFGE, Ms. Dorothy James.
Thank you very much, Anna. We're out here today, not just here at the Hines VA Hospital, but we are across the nation. We're across the nation to try to get the attention of Congress and the public to fund the VA, to staff the VA. There is a shortage of nearly 50,000 workers in the VA. And at this hospital, there's a shortage of almost 500 people to staff the VA. The VA has been criticized over the past few years for not fulfilling their obligations to veterans. Yet and still, Congress has failed to fulfill their obligation to staff and fund the VA hospital. Without these workers, we have nurses that are working double shifts, that are unable to fulfill their personal responsibilities and burn out. And these conditions exist not just here, but all over the country. So we're pleading with Congress to establish the Transparency Affordability Act and to staff and fund the VA. We have veterans who want to maintain their care here at the VA. But as the backlogs increase and the work increases, they're likely to try to find other places for service in the community. And that should not be the case. The VA should be properly funded, and we want that message loud and clear across the country.
Thank you, MVP James. Our next speaker will be Mr. Walter McKinley.
Hello, my name is Walter McKinley. I'm a Navy Vietnam veteran, and I like to say that I feel honored being here today because I have definitely been benefited by the specialized healthcare programs at Jesse Brown VA Hospital. As a matter of fact, I would be in a wheelchair today if it wasn't for the healthcare that I've gotten to the VA, and I am so grateful. And I'm grateful for Donna, Chris, Jill, and Lil, those individuals who made me feel more than a number. And the care that I've gotten there has been remarkable. I go on a weekly basis to groups that help me with my problems, with my issues and things of this nature, and I've benefited tremendously. And I would hate to see it go on the tube. I would hate to be in a line waiting for care when I know that I could get specialized care that's tailored for me at the Jesse Brown VA. And we're all veterans, we're like a family. And I get a thrill, and I'm really pleased by coming here and being with my fellow veterans and my fellow comrades here at Jesse Brown VA. And I'm a poet, and I'd like to share a poem that I've written. And it covers not only my veteran males and females at Jesse Brown, but to the veterans all over this great nation. I am a veteran. I've done my time. I've risked my life for this land you call mine. World War I, I could vaguely see. Sometimes the thought just startles me. World War II was kind of hard to bear. When I see the bombs falling through the air, I can see the nights when they look like day. I can see the ships sinking at the bay. I am a veteran, I'll stand and tell of North Korea. Man, was it hell? But we held our ground and kept our flag. Not one American bowed or lagged. I am a veteran, I don't brag or bluff, but I went to the sands of the Persian Gulf. I am a veteran, some don't give a damn, but I crossed the water, fought in Vietnam. I am a veteran, I'll stand tall and say, I'm glad I went and fought for the USA. Congress, don't let us down. Thank you.
Thank you, Mr. McKinley. That was a wonderful poem. Our next speaker is Mr. Reggie Wills.
Good morning, everyone. My name is Reggie Wills. I've worked at Jesse Brown VA now for 14 years. I work in the EMS department. I'm also a proud veteran who served in the Coast Guard for 7 years. Jesse Brown is a very special staff veteran hospital. Louder. For our veterans. I'm proud that I still get the opportunity to serve my country and support my veterans, but in a different way. Jesse Brown is more than a hospital and clinic, it's also a community. It gives our vets vital health care, job support, and a sense of belonging, and is a place of healing. It's why we must keep a very strong VA, well-resourced, well-staffed, and be able to effectively treat our vets, our families, and our community. Our workforce is stretched out and stretched out thin due to the vacancies throughout the system. Short staffing is a constant issue for all frontline hospital workers like myself. When I show up to work after being off for a couple of days, I have to scramble because my work has built up so much. When another EMS workers call off sick, we have to do double time because we don't have the flexibility to cover our shifts. This issue affects all of the hospital from bottom up to top down. That's why we're raising the alarm today. The vacancies here at Jesse Brown and across the VA are damaging our overall workforce. They are forcing patients and veterans to find treatment elsewhere. Private hospitals don't understand what the veteran needs. They are a backdoor toward outsourcing and privatizing the VA. The motto of the Coast Guard is Simperatus. That means always ready. Well, we're not ready. We're not treating our veterans as well as we should because of these vacancies. I'm calling on administration, I'm calling on Congress to fix this problem immediately. We need our federal government to give the VA the manpower and the resources to fill these vacancies. Give us the tools to honor our veterans by giving them a better quality of life. God bless you, and God bless America. Thank you.
Thank you, Reggie. Our final speaker today will be President Greg Kelly from SEIU Healthcare Illinois.
All right, thank you, Anna. Thank you. Good morning, everyone. Good morning, brothers and sisters. Indeed, an honor to be here for all of those folks who proudly served our country. My name is Greg Kelly, and I'm the president of SEIU Healthcare Illinois and Indiana. Our union proudly represents the amazing and dedicated hospital workers at both Jesse Brown and Hines VA. Our VA hospital workers tell us that they are constantly facing short staffing issues. Just imagine for a second being at your job, knowing that the patients you're caring for are caring for and supporting veterans. Every second, you feel like you can't work fast enough just to get the job done because your department is missing staff. You're always thinking, how in the world can the work get done if another colleague gets sick? You have no slack in the system, as they say. This is why we honor all of the VA hospital staff members whose work ethic dedication, and professionalism is second to none, and who deliver patient care despite enormous challenges. When we talk about the scale of the vacancies at the VA, nearly 49,000 nationwide, and estimated at 546 at Jesse Brown alone, we're talking about a major stress on our hospital workforce. But the larger threat is that these vacancies are pushing veterans into private hospital care and clinics that likely don't understand the unique health challenges that veterans face. It's also a step towards privatizing the VA, which no one, especially vets, support. This hollowing out of the VA workforce and the Trump administration and Congress's inability to act quickly enough is undermining one of the core institutions that veterans rely on. An understaffed and under-resourced VA is a detriment to and a disrespect to our veterans. It denies them the community and the vital support that vets need to heal and recover. Now, many of these vacancies could be filled by vets who not only want to work and have the dignity of having a job, but also to be surrounded by fellow servicemen and servicewomen. Filling these vacancies would provide them with that opportunity. The crisis of these vacancies at the VA are simply inexcusable. And that is why we are here today to call on VA Veterans Administration Secretary David Shulkin and the Trump administration, as well as Congress now, to immediately provide the VA with the resources to fill these critical positions. Our brave men and women and their families did not delay or hesitate to serve our country when they were called upon. Our political leaders in Washington must act now with a similar sense of urgency. Our commitment to our vets means we must ensure that we have a strong and effective workforce at the VA to deliver that patient care and make good on our commitments to those who served our country and their families. Thank you, everybody.
Thank you, President Kelly. And once again, I would like to thank everyone who came today to show their support. We have several staffers from congressmen's offices here today, so thank you for coming. We have several community folks here today. Thank you. And again, thank you to the press. Thank you.